Okay, today we're going to start looking at all of the major skeletal muscles. So we're going to start labeling, seeing where actual muscles are. So I'll talk about some that I expect you to know. Today we're mainly going to focus on face or head and neck area. However, all muscles are named according to multiple things. They might be named according to size, shape, location, action, what they do, number of attachments, what its fibers are like, or combinations of those that are listed. So these are just 6 examples. And these 6 are common muscles that you should know. So one example, pectoralis major. Your pecs are your chest muscles. So pectoralis major means it's big. It's located in the pectoral region. That's where its name comes from. Deltoid is in the upper arm, and it deals with the shape, kind of a triangular deltoid shape. That's where the name comes from. Extensor digitorum is going to extend your digits. So it's obviously, and start thinking, so if I'm extending my digits are coming up. The muscles that are going to do that have to be on this side because they're pulling those muscles, are pulling those bones up. So extends the digits. That's where it gets its name. Biceps brachii. Brachii deals with arm. Biceps means 2. So biceps brachii is in my arm, and it has 2 points of attachment. Sternocleidomastoid actually tells where it's attached. So sternum, it's going to attach at the sternum. It's going to attach at your mastoid process. So it's going to extend and kind of cause some twisting motions. And then external obliques are in your abs. External means they're going to be an outside layer of muscles. And obliques run diagonally, so they're going to deal with twisting motion of your abs. So, here is a picture that has major muscles on it. I'm not going to read through all of these. You can look at this, and I'm going to break it into smaller parts. But everything that's on here is a major muscle that you should know. So if you want to maybe star this as a review before the test, I am going to move on from this picture and break it into smaller pieces. And we'll look today, like I said, at this area. Then we'll look at the chest and back. We'll look at the arms. We'll look at the legs. We'll break it into smaller pieces, so that you're not memorizing everything at once. And same thing with the posterior side. These are major muscles. The only ones that I might not have, like teres minor, teres major, these are deep muscles. They're actually covered up by your latissimus dorsi. They've just peeled part of it back here. Those probably won't be on the test, but most of the other ones. So today we're going to look at the face and head. Muscles of facial expression, so smiling, frowning, pouting, creasing your eyes, all of those are going to attach to bones that are on your face, obviously, and then connective tissue of the skin. So we started dissecting cats last period. That connective tissue is very easy to see when you start to peel the skin away. You can actually see what that connective tissue is like. Major muscles in the facial expression, epicranius, orbicularis oculi, orbicularis oris, buccinator, zygomaticus, and platysma. So yes, these you should know. So if I'm looking at them, epicranius is actually broken into 2 parts. So the frontalis muscle is going to be in your frontal, covers your frontal bone. And then you have an occipitalis part that's towards the back, and then this aponeurosis is the band that kind of connects them. So if I look at my temporalis, when it contracts, it's going to lift your eyebrows. So as this contracts, it's going to lift your eyebrows. Orbicularis deals with circular. So orbicularis oculi is the muscle that runs around your eye, causes it to close or to squint. So it's going to close the eye. Orbicularis oris is the circular one that goes around your mouth, and that's more for kind of puckering up, closing your mouth, things like that. Masseter, probably the strongest muscle in your face. If you clench your teeth, you should feel your masseter just kind of bulge out in your cheek area. So your masseter closes your mouth and clenches your teeth. Buccinator is basically your spitting muscle, is what I would call that. So it's used to force or to blow, if you're in band and playing a horn. And so blowing air, spitting, the buccinator is very important for that. Zygomaticus is your smiling muscle. So when that lifts, it's going to pull your lips up. So the zygomaticus is what causes you to smile. Sternocleidomastoid. Here you can see how it's a diagonal muscle. So when it works, it's going to basically like pull your head down in kind of a twisting or a little bit of a sideways motion. Trapezius is along the back. We'll talk about that later. And platysma, a little bit with pulling down, but more for, when your platysma, you can see the muscles if you like really pull down and then it sticks out. So platysma is a large band muscle that basically extends from the bottom of your jaw down through your neck. Table tells you what they do, where does it originate, where does it insert, and what is its job. So here again, good review that goes with the picture that we just looked at. Mastication deals with eating. So chewing movements include up and down, side to side as you're chewing on your food. Grinding motions. Chewing muscles include the masseter and the temporalis. So like I said, the masseter, you can feel that in your cheek when you clench your teeth very easily. And your temporalis is actually where your temples are at. So kind of same thing. If I clench my teeth again, you can feel a tightening up in your temporalis also. So I can feel it tighten here and here. And those are the two main muscles that deal with eating. Moving the head then, sternocleidomastoid is the main one that's going to move your neck back and forth. I'll flex a little bit. Splenius capitis, semispinalis capitis, not as important to remember as the sternocleidomastoid. So as far as test purposes, sternocleidomastoid is the more important. Here you can see pictures. Obviously, your capitis muscles are going to pull your head backwards because they're located at the back. Sternocleidomastoid is going to pull forward. And that, I believe, is where we'll stop for today. So here's the table that goes over it. And then next time we'll move on to other muscles of the chest and back area.